Hello, dear students and nursing aspirants. Welcome back to my YouTube channel Nursing Concepts by Raghav. आज के इस वीडियो में हम बात करेंगे. So in the last video I have discussed the concept of ethical principles. So in the today's video I am going to discuss some of the important and possible MCQs on that ethical principle concept. Okay, so if you are watching for the first time my channel, then please do subscribe and press on the bell icon so that you never miss a video when I post in the channel. And I request everyone, before watching this video, so you first watch the video on the concept of ethical principles, so that you can understand the concept first, and then you can watch this video, then you will understand better regarding the MCQs approach. Okay, so the link I have given in the description box, and you can watch that video first and then come back to this video and watch the MCQ discussion on the ethical principles. So let me start with the MCQ discussion. See, before I discuss the MCQs, let's have a brief uh, discussion on the what principles we have discussed, okay, in the concept of ethical principles, because the major questions what you get in the exams are based on the ethical principles only. Okay, so we'll have an just I will take on some 60 seconds to revise all those ethical principles, so that you can remember it and it will be helpful to answer the MCQs. See, the basic principles or ethical principles, first is autonomy. Okay, so autonomy is nothing but auto means self. Okay, where the patient has a right to take his own decisions. Okay, so he can take his own decisions or he can make his own choices related to his care. So that is what the autonomy. And the beneficency, so beneficency means it is doing good. Okay, whatever the things we do in with the patient, that should make some benefit or good to the patient. Then non-malefficiency, the non-malefficiency the patient where the patient is normal means not doing harm. Okay, so not to do any harm, not doing any harm, so that is what we call it as a not doing harm. Then justice, not doing harm in the sense of physically, mentally, and as well as socially, so we should not do any harm to the patient. And the next ethical principle is justice. Justice means it is treating all the patients equally and fairly. Okay, so based on the need or based on the emergency requirement, we should treat them equally. And then fidelity means keeping the promises or being committed to the promise. Whatever the promises you make to the patient, you should be committed to your promises. Then veracity means it is telling the truth, giving an accurate information or providing a truthful information or true information related to the patient. Then accountability, where you should take your own responsibility for your actions. So whatever the actions you do on the patients, you should be responsible for that. Then confidentiality and the privacy. Confidentiality means it is keeping the information confidential or secret. Without the patient consent, we are not supposed to reveal or share the information to anybody else. That is what the confidentiality. And other than that, we have an human dignity and even the advocacy. Okay, advocacy means it is to protect the patient's right. Okay, we should always talk in respecting or in safeguarding the patient's right. Then dignity means it should always respect the patient, so that is all the dignity is there. Then now we have discussed some legal actions or the legal issues like commission and omission as well. In the commission we have discussed like commission means doing the wrong thing. Okay, that suppose that should not have been done. Then omission means failing to do the right thing. Okay, or failing to do the work that should have been done. So this is what the omission and the commission. So these things we have discussed, and even the negligence also we have discussed, where the nurse fails to do the responsible activities, or the nurse fails to do what she has to supposed to do. It is something like an omission only. Okay, so then malpractice, it is something like a commission, doing the wrong thing. So that's all thing we have discussed in the concept of ethical principles. So now let us discuss the MCQs on this concept. So the first MCQ here I have taken is a nurse is caring for a patient who refuses for a life-saving a surgery. Okay, a nurse is caring for a patient who refuses a life-saving surgery, and the family insists a surgery to be performed. Which action by the nurse is most appropriate? See, when you approach an MCQ, always read the question very carefully. Okay, what the question is asking or the examiner asking. Don't take it as in your own way. Okay, don't think as per you. Okay, you should think as per the examiner, what the examiner is asking, what actually the question is asking. In that way you should think, and in that way your approach should be there. Okay, एग्जाम में जो भी क्वेश्चन पढ़ते हैं तो एग्जामिनर के हिसाब से पढ़ना क्वेश्चन, क्योंकि आपके हिसाब से तो क्वेश्चन नहीं रहेगा. ओके, आप कुछ समझोगे वैसा नहीं रहेगा. जो एग्जामिनर जो चाह रहा है या पूछ रहे हैं, या व्हाट द एग्जामिनर वांट्स इन द क्वेश्चन, दैट यू हैव टू understand with the question. Okay, that is very very important. And the second thing is also we should always look for the keywords. Okay, keywords in the question. So here in this question there is a keyword like most appropriate. Okay, so in the some questions maybe like first, last, least. Okay, except. Okay, then all or nothing. So like that some keywords might be there in your MCQs or in the question. So you should be very careful when you read a question. You should always consider these key words, and read all the options, okay, very carefully before you choose any option. So because sometimes you may feel, while when you read the first option itself, you feel that yes, this is the right answer. Okay, don't be hurry in choosing the option. Okay, before, without reading all the options, don't go for any right options. Okay, maybe it is right or maybe it is wrong. Don't go without reading all the options. So that is very important when you approach a question. See, here the options are: inform the family that their wishes will be followed, contact a surgeon to schedule the surgery, respect the patient decision, inform the healthcare team, ask the patient to reconsider until they agree. See here, what the actually the examiner is asking, or the question is asking, or what information is being given in the question. So let us see. See here, a nurse is caring a patient who refuses a life-saving surgery. So that means the patient needs a surgery here. Okay, to safeguard his or to save his life, the patient needs a surgery, but he is refusing. Okay, so he is refusing. What decision he has taken related to his surgery? He refused. Okay, this is what decision, or this is the choice of this patient related to his care. He doesn't want a surgery, but the family insists the surgery to be performed. So what the family is telling, you do the surgery. Okay, family insisting for surgery. So which action would be most appropriate? See here the question is asking what action the nurse has to take which is very appropriate. Okay, most appropriate, that is what the question is asking. The first option here: inform the family that their wishes will be followed, contact a surgeon to schedule the surgery. See here in the, when you look at the first option, inform the family that their wishes will be followed. So of course it is a right. Okay, because see in this what ethical principle you can identify with this question? Making the self decision by the patient. So this shows ethical principle of autonomy. ओके, यहाँ पे पेशेंट खुद डिसाइड कर रहा है कि उनका सर्जरी चाहिए या नहीं. ओके, सो सर्जरी वो बोल रहे हैं कि नहीं करना है मुझे, तो वो इनका खुद का डिसीजन है. सो दैट वी हैव टू रेस्पेक्ट. So that is the ethical principle. Okay, so autonomy is the ethical principle which is being followed here, okay, which has been involved in this statement. So means what is our role of nurse in ethical principle following this autonomy? We should always respect the patient decision, whether it is a right or wrong. See here, we should inform the family that their wishes will be followed. So of course this looks to be a right, because we have to follow the patient's decision. Okay, patient जो patient का विश है वो follow करना है. So then second option देखो, contact a surgeon to schedule a surgery. See here it is absolutely wrong, because when the patient doesn't want a surgery, we are not supposed to contact the surgeon for to schedule the surgery. Surgery patient को नहीं करना है, तो ये बात ही नहीं आता है कि सर्जरी का शेड्यूल करना. ओके, सो ये बिल्कुल गलत है. तो ये थर्ड ऑप्शन देखो, रेस्पेक्ट द पेशेंट डिसीजन, इन्फॉर्म द हेल्थ केयर टीम, then ask the patient to reconsider until they agree. See here, this can also be done, because we should respect the patient decision. We can ask the patient, okay, see this is a very life saving surgery you need to undergo in order to save your life. So we can tell the patient to reconsider his decision, okay, or to make another decision related to his care. But here this option is wrong, because until they agree, okay, here the word it is given until they agree. So we cannot force or we cannot tell repeatedly the patient, or we cannot make a force the patient to agree for the what the doctor had made a decision. Okay, so that is forcing the patient to make or to change his decision will not be there. So these two options are wrong. So options two are left with us is the inform a family that their wishes will be followed, respect the patient decision, and inform the healthcare team. See here, we can inform the family, that is well and good, but here the major what the question is asking, which is most appropriate. Okay, so that takes you to this answer. So we should always respect the patient decision, and then this decision should be conveyed to the surgeon or to the healthcare team, so that they can plan according to the patient decision. So the right option here will be respecting the patient decision and inform healthcare team. So this is how we can approach an MCQ, and what things you have to look at in the question, and how we should consider each and every option for choosing the right option. Okay, so let's move on to the next question. A nurse explains the side effects of chemotherapy truthfully to the patient. This is an example of, here are the options: fidelity, autonomy, veracity, and the justice. See here in the question, if you look at the question, what the nurse is doing, she is giving an explanation related to the side effects chemotherapy, that is truthfully. Okay, means a true information related to the chemotherapeutic drug side effects she is giving to the patient. She is explaining, means giving a truth information or telling the truth to the patient. Okay, that is what the question is asking. So telling the truth means what is that ethical principle? Telling the truth is a veracity. See here the options: fidelity stands for the commitments to your promises. See here in the question, she is not making any promises to the patient. Autonomy means here the patient doesn't take any decision, self decisions here. Veracity stands for the, that is a truth telling. Okay, she is telling the truth to the patient. And justice means here treating the patient. Okay, anyway here there is no any impartiality scenario in the question, so this doesn't come over here, and the right option will be the veracity. Okay, telling the truth. तो यहाँ पे जो नर्स है कीमोथेरेपी ड्रग का साइड इफेक्ट्स सही तरीके से और सही इन्फॉर्मेशन दे रहे पेशेंट को, तो ये सही इन्फॉर्मेशन देने का जो एथिकल प्रिंसिपल है, दैट इज व्हाट द वेरासिटी. So the next question here, giving a priority to an emergency patient. Okay, तो यहाँ पे क्या है, प्रायोरिटी दे रहा है. गिविंग अ प्रायोरिटी to an emergency patient in an emergency room over a stable patient is an example of. तो यहाँ पे and options are beneficiency, justice, autonomy and the mal efficiency. See here in the question she is giving a priority to the patient. Priority to the patient एक emergency consider इसमें जो scenario है एक emergency department को और emergency room को दो patient आया है, इसमें एक emergency patient है एक और stable patient है. ओके in this scenario तो इसमें क्या है, नर्स इज गिविंग अ प्रायोरिटी. प्रायोरिटी का मतलब है इसको पहले ट्रीट कर रहा है ओवर दिस पेशेंट. ओके इसको बाद में देख रहा है, पहले इसको पेशेंट को प्रायोरिटी दे रहे हैं. तो इसका मतलब यहाँ पे कौन सा एथिकल प्रिंसिपल फॉलो हो रहा है. okay? सो ये है देखो बेनिफिशिएंसी. बेनिफिशिएंसी मीन्स डूइंग गुड. so obviously doing good here to the patient, so that is also can be considered. And justice, see here the just autonomy means here the patient doesn't make any decisions over here, so this cannot be done here. And non-mal efficiency, she is not doing any harm to the patient. Okay, instead she is doing good to the patient. See here two options are left, beneficiency and the justice. She doing good. Okay, anyway she is doing good to the both the patients. Okay, she is attending the emergency patient first and then even she can attend or she is prioritizing this patient. But here the when it comes to the justice and the beneficiency, see best justice when comes, it will comes to the when there is a comparison. Okay, or when there is a multiple options for the patient care. से फॉर एग्जांपल अगर दो पेशेंट्स है, ओके दोनों को आईसीयू बेड्स चाहिए, उसमें एक पेशेंट ज़्यादा ही क्रिटिकल है, एक और थोड़ा सा स्टेबल है, इसमें किसको कौन सा पेशेंट को हम आईसीयू बेड प्रोवाइड कर सकते हैं. जैसे ऐसे कंडीशन में जब मल्टीपल ऑप्शंस रहता है या बहुत सारे पेशेंट्स रहते हैं, उनमें हम किस पेशेंट को जस्टिस दे सकते हैं, ओके या कंसिडर कर सकते हैं. So that is what the justice. See here in this case scenario we have two patients over here, emergency and the stable. So to provide an justice to the patients, so first we have to take care of an emergency patient. See, suppose if the nurse gives an priority for the stable patient, what about this emergency? This patient might die. Okay, so means she is injustice to this patient. So always our ethics what says we should always give priority, or the triage system is like that only, always treat the emergency cases first and then the stables. So this is what the justice. So here the right option will be the justice. Okay, so the next question, a nurse provides a pain relief medication. Okay, in the question what pain medication will be given to the patient. Okay, pain relief medication, even though the medication may cause a mild drowsiness, this reflects what? The options are justice, beneficiency, veracity and the autonomy. See here first we should understand what actually the question is. The patient nurse is giving an injection or a pain relief medication. Okay, is giving a pain relief medication. She knows that to relieve the pain. Okay, pain medication for the pain, so means she is doing good to the patient. Okay, but similarly she knows that this pain medication may cause a drowsiness. Causing drowsiness is doing good to the patient? No. Okay, so this is not doing good. Okay, see, but when the a beneficiency comes, a beneficiency means doing good or benefit. So we should always think of the two things. One is a risk and the benefit. Both the ratio you should consider. When we should always think of there should be a more benefit and with the less risk. Okay, so benefit एथिकल प्रिंसिपल जब हम फॉलो करते हैं तो हम दो चीज़ें याद में रखना है. एक है रिस्क. ओके, इससे क्या रिस्क होता है और बेनिफिट होता है. ज़्यादा रिस्क होता है या ज़्यादा बेनिफिट होता है, ये दोनों चीज़ें ज़रूर देखना है जब हम बेनिफिशिएंसी और एथिकल प्रिंसिपल फॉलो करते हैं. तो ऑलवेज हम ये याद में रखना है कि उसमें रिस्क कम रहना है, बेनिफिट ज़्यादा रहना है। तो मीन्स द बेनिफिट शुड ओवरटेक द रिस्क। तो अगर हम ये मेडिकेशन एडमिनिस्ट्रेशन करने से उसको ज़्यादा बेनिफिट हो रहा है, सो ड्राउजीनेस इज़ नॉट अ मच मोर अ प्रॉब्लम, ओके, इंस्टेड इज गेटिंग रिलीफ फ्रॉम द पेन, so that is the more benefit is getting from the pain. So this is what we are making a benefit to the patient, doing good to the patient even though there is a risk or a problem with the patient. So always think these two components when you are considering a benefit. See, justice doesn't come here because there is no any comparison or there is no any multiple options over the patient care here. Then veracity, telling the truth, so she is not being giving any information here. Autonomy, the patient is not making any decision over here, so the right option will be a beneficiency. The next question है, a nurse tells the truth. She tells the truth to the patient about the poor prognosis despite of the pressure from the family to hide it, which this reflects which ethical principle? This reflects which ethical principle? Veracity, justice, fidelity, and autonomy. See here in the question itself, she is telling the truth in the sense, so that is what the veracity. Okay, she is telling the truth to the patient. तो यहाँ पे in this case scenario what happens, patient का जो poor prognosis पता है नर्स को, एंड फैमिली बोल रहा है कि इसको मत बोलो। एक अगर एग्जाम्पल के तौर पे अगर बोलना चाहे तो एक पेशेंट को कैंसर हुआ है, ओके, और पेशेंट कुछ दिनों में मरने वाला है, तो ये फैमिली को भी पता है, लेकिन एथिकल प्रिंसिपल क्या बोलता है वेरासिटी, whatever the true information related to the patient we should tell to the patient, okay, जो भी डायग्नोसिस है या जो भी प्रोग्नोसिस है we should always explain truly and truthfully to the patient. Later the decision will be left to the patient, okay, so telling the truth is an ethical principle. लेकिन यहाँ पे फैमिली बोल रहा है कि ये जो पेशेंट का जो कंडीशन है पेशेंट को मत बोलो। तो अगर नर्स ने मान लिया कि फैमिली का बात मान लिया और पेशेंट को ये नहीं बताया पेशेंट का कंडीशन, तो ये ब्रीच ऑफ वेरासिटी हो जाएगा, ब्रीच ऑफ एथिकल प्रिंसिपल हो जाएगा। तो इसलिए it will be again a legal implication. So telling the truth to the patient will be an ethical principle. See here in which ethical principle she is following. So veracity, justice is not been applicable for this patient. Then fidelity, she is not making any promises over here. Then autonomy, the patient doesn't make any decisions over here in this scenario. So the telling truth itself will take you to the answer, that is veracity. Okay, the next question here, a patient with the terminal illness, okay, the patient is in the terminal illness and ask the nurse, am I going to die soon? The nurse knows that she knows that the prognosis is poor. Which response best demonstrate the ethical principle of veracity? Okay, so they asked, this is something like an the NCLEX type of question, okay, where there is a very descriptive question will be there, okay, scenario will be there. Even in the NORCET we can expect nowadays they are asking a very descriptive questions, so you may expect these kind of questions in the upcoming NORCET exams. See here, the patient is in the terminal illness, means in the end stage of care, okay, or the terminal means at the end stage of the disease. Then he asked the nurse, am I going to die soon? The nurse knows that the prognosis is very poor, okay, she knows that the patient definitely going to die very soon and the prognosis is not good. And which best demonstrate which response, okay, so how she can respond that demonstrate or that indicates that she has followed the principle of veracity. So the first option here is you will be fine, let's not think about that now. So what it means, you will be fine. See, suppose if she tells this you will be fine, because she knows that the prognosis is very poor, okay, so if she tells you will be fine, then this is giving a false information. She is not given a true information because she knows that, okay, if she This is called as deception. Giving false information, that is a deception. Then I think you should talk to your doctor about that. See, when she knows the condition of a patient, she knows that the prognosis is poor. There is no way of, or there is no question of saying you should talk to the doctor. Okay, so because it is a professional ethics, we should follow it. We should tell the patient condition if we know it. Okay, so here the patient, the nurse knows, but she doesn't tell. She should not tell like you should talk to the patient. So this is also wrong. This is also wrong. Then your condition is very serious. A condition is serious, the doctors believe time may be short. Then fourth option is don't worry, we will do everything we can. See again, don't worry. If she says don't worry, means there is already the prognosis poor. If you say that the don't worry, means again she is giving a very false a false information. Okay, so this is also and wrong. See, your condition is serious, she is explaining. Veracity means the telling the truth. She is explaining it in very nice way. Your condition is serious. Okay, because the prognosis is poor, she is telling your condition is serious and doctors believe the time may be short. So she is not taking on her head. She is telling the doctors believe that your time may be short. So that means he is going to die very soon. She has conveyed in a very ethical manner. Okay, so this is what we call it as a ethical or the professionalism. Okay, in the ethical way she has conveyed the veracity or the information truthfully to the patient. So this, the C will be the right option for this question. The next question here, which type of a negligency, which a type of negligency occurs when a nurse fails to give a prescribed medication? Okay? Act of commission, act of omission, malpractice, and the assault. See here, what kind of negligence they are asking. You first understand act of commission, act of omission, malpractice, and the assault. As I told, so in the act of commission, commission means where she does the wrong thing. She does the wrong thing that supposed that should not have been done. Okay, तो नहीं करना चाहिए था, वो गलत काम कर दिया. So that is what that does. She does the wrong thing or the wrong action. यहाँ पे क्या है, he fails to give the prescribed medication. जो मेडिकेशन देना था लेकिन नहीं दिया. तो एक्ट ऑफ ओमिशन क्या है? एक्ट ऑफ ओमिशन जो है, जो करना चाहिए था वो लेकिन नहीं कर पाया. तो मीन्स he fails to do the fails to do an activity which is to be done, which is to be done. Okay? जो करना चाहिए था लेकिन she fails to do it. So that is what the act of omission. And malpractice is something like it is doing the wrong thing. It is similar to the commission. Then assault is a kind of tort. Okay, where we do the physical harm without touching the patient, without touching the patient. Okay, say for an example, forcing the patient to take medication. Okay, and threatening the patient like or restraining. So these kind of physical harms without touching the patient can be considered as an assault. See here, the question is telling that the nurse is unable or fails to give the prescribed medication. जो medication देना चाहिए था prescribed medication, वो लेकिन दे नहीं पाई. तो इसको, it's completely an act of negligency. Okay, it comes under the act of omission, because omission means where the nurse fails to do the activity or the action which is supposed to be done. So that is what the act of omission. And the next question here, which is an example of a malpractice, which is an example of malpractice in the nursing. Option here, accidental spilling of a patient's drink, a failure to monitor the patient after administering the sedatives and leading to an injury. Then a patient failing despite of all the safety measures being followed. then refusing to share the patient details with the media. See here in the first option, accidental spillage of patient drink. So it is not an any malpractice over here. So these kind of things will happen. Okay, so spilling of the patient drink may be like water, juice, whatever it is. So spilling is not an issue. Okay, so malpractice means it isn't. You should consider it as a legal issues. Okay, so spilling and patient drink is not a legal issue. Then failure to monitor the patient after administering a sedative and leading to an injury. So it is necessary. See here, the patient has already been administered with the sedative. Okay, so sedative and leading to injury, and she failed to monitor the patient. See, after giving a sedation, it is very important to monitor the patient's respiratory status, because the patient may go for the respiratory arrest with the sedatives. So that is what the responsibility of a nurse, to monitor the patient. If she doesn't do it, then it is an negligency, or it is a malpractice. Okay, so leading to an injury. Then patient, then the option, so then third option is patient falling despite of all safety measures being followed. See, when she doesn't follow any safety measures, if patient falls, then it's a negligency. But here in the option, she has taken all the safety measures, instead the patient has fall. So this is not her, she is not wrong with any in any part of her. Okay, because she has already taken the safety measures and she has followed it, but despite of that the patient had a fall. So that is, there is no any wrong with the nurse. Then so it is a right thing. Okay, then refusing to share the patient details with the media. See here, so this says it is in confidentiality. Okay, she refused means she is maintaining the confidentiality of the patient. So if you doesn't maintain the confidentiality, then it will be a legal issue, but here she is maintaining. Okay, she is refusing to give the patient details to the media. So that is what the confidentiality ethical principle she followed. So this is also a right thing. So but wrong thing, that is a malpractice what she did. Wrong thing is the failure to monitor the patient and after being administered with the sedatives. Okay, that is causing the injury. So this is the right option. So these are the some possible and a selective MCQs based on the concept of ethical principles in the nursing. So you can, now you understood the concept, and even I have discussed the some possible MCQs and very important MCQs. So that, and even I have told you how to approach and what things you have to look at in the question, and how to identify and correct option with the MCQ. So I hope the today's MCQ discussion was very helpful and understandable. Okay, so uh, we will see you in the next video with a different topic, and please do subscribe to my channel. Just if you like this video, please click on the like button, share it to your friends. Okay, because sharing is caring again. So if you are sharing this video to your friends, or those who are in need, so that means you are taking care of your friends. So please do share, subscribe to my channel, and don't forget to press the bell icon, so that you will receive a notification on of my next video. Okay, so till then, take care. So let's walk together, we'll find a way to a success. Thank you.